Hello there. I'm Dr. Rajendra Prasad, Senior Consultant Neuro and Spine Surgeon at Indraprastha Apollo Hospital, New Delhi. Today I want to just talk about an interesting case, something that is unusual in that it's not required that frequently. It is what is called a spinal cord stimulator, and this has been used in this case for pain. So the patient is a 50-year-old gentleman who had an injury to his L1 lumbar spine 10 years ago. And that caused him to have complete loss of power in his lower limbs. But there was some sensory preservation up to the knee joint. But what was distressing for him was the severe pain in both lower limbs. And this is the normal spinal cord. And at this level, you can see this is the L1. That there is severe damage and the nerves below is seen. So just at that level, there are only a few intact fibers that was responsible for sensory being preserved up to the knees. But the pain had to be treated. So I thought after assessing him, the best option was to try a spinal cord stimulator. And normally it's put in the thoracic spine, just above the level of the injury. So roughly about there. So if this is L1, D12, D10, D11, thoracic 11. So at the level of 9 and 10 thoracic vertebra, a spinal cord stimulator was placed over the spinal cord. And this surgery was done awake under local anesthesia. And then we were able to stimulate the spinal cord and ask him what is happening to your pain. And normally we would do a trial lead, then wait for a few days and then have a permanent lead put in if it was helpful. But in this case, because he had come from abroad and there was no other option but to put the spinal cord stimulator. So I decided to put it under local anesthesia, but checking with him, because the device itself is expensive, almost $15,000. So we didn't want to waste it. On the other hand, we didn't want multiple surgeries. So I inserted this under local anesthesia, and then when we stimulated it and asked him, he said, no, I have no pain. And so we then put him to sleep again and sutured the wound. And then over the next few days, we were able to get the right stimulation current so that he could be comfortable. And I'm happy to say, from a pain score of 9 over 10 in the left limb and 8 over 10 on the right limb, it's now 0 over 10. So spinal cord stimulator can be life-changing for somebody like him. And because he lives in Africa, many devices have previously used to have a battery life of 1 year or 2 years, but this new kind of spinal cord stimulator that I've used has a battery life of up to 15 years. So it's only after 15 years would he need to recharge or change the batteries. In the meantime, he can switch it off, switch it on, change the current, modulate the type of current he needs. I'm here with the patient who has very kindly consented to talk to us. I'm interested to know his experience of spinal cord stimulator that we've put in. So thank you, sir, for coming and agreeing to do this. I'm just interested for our listeners to know, audience to know about your pain. So you had an injury 10 years ago, but the pain started when, and what was the character of the pain? How was the pain? Which leg was the pain? What type of pain? And then you tried all your medication. What did you try? And then we'll talk a little bit about the surgery and how it has helped us. So can you tell us how much pain you had for 10 years and more recently 3 years? So you can talk about that.
Yeah, after getting injured, I started the pain. Gradually it was increasing, but 3 years back, it's more high. Because I was taking tramadol and tramadol pills from that time until it came a time I have to shift it to the injection.
So you were getting injections of tramadol and other painkillers
Yeah.
once a day?
No. It was once a day, It will come 2 times a day. It will come 3 times a day.
So 3 times a day he needed injectable painkillers. Where was the pain? Was it in the back or the legs?
From the back until the legs.
Which leg? Both legs?
Both legs.
And one was more severe than the other.
The left one
Okay.
was more severe.
And out of 10, what was your pain score? In spite of being on 3 injections a day, in between,
Sometimes it's going to be 8 to 9
8 to 9 out of 10.
out of 10.
Right. And was that keeping you awake in the night, or would it only happen in the day and you were able to sleep peacefully at night?
Any time we can get the pain, but it makes me sometimes not to sleep, even not to eat.
You couldn't eat, you couldn't sleep when the pain was there.
Severe.
And the pain was almost every day.
Yeah.
Okay.
Almost every day, because I was being injected every day.
Yeah.
3 times
So-
a week.
That was the seriousness of the pain. So we chose to give the spinal cord stimulator, and we did that. So what was your experience? Because you were not under full anesthesia, you were under local anesthesia, but some medicine to make you sleepy. Were you in pain at all during the procedure of surgery?
I didn't get any pain during that procedures.
But after that, when we stimulated, you were awake. Could you feel any currents going to your leg?
Yeah.
You did.
I feel some currents passing the legs and no pain.
Yeah. So during the testing at surgery, he could find the currents going down his leg. That was just to check that the leads were well placed. So after surgery, it's now been just a little over, not even 2 weeks. So how is the pain now? Out of 10, what is the pain?
Out of 10, sometimes it is 0 up to 10. Because
So-
I'm not taking any pills, no
Yeah.
injection for pain,
Right.
and I don't feel any pain.
So just over 10 days from surgery, he's not on any painkillers, no injectables, no tablets, and he's basically 0 out of 10. So would you say this was a useful surgery?
Very useful.
Yeah.
Very useful for my life.
It will change your life. Was it impacting you psychologically before?
Very, very.
You were feeling what?
Yeah, it was imbalancing to me. The pain was very severe.
Were you in a job? Will you be able to do some work now? Sit
Yeah,
on the chair
I
and do
can.
some work?
Because I'm a computer engineering, I can do my work.
Right. And also you were able to transfer from bed to chair, chair to bed. All that
Even-
because of pain, it was getting hampered.
Yeah, because of the pain, to get it harder to me.
Yeah.
But now I can transfer even from the wheelchair to the car myself.
So suddenly it has just given you a new life.
Very,
You can
very.
get back to work and you can do your lead and all.
I can do better.
I want to talk about the spinal cord stimulator. What are the conditions for which they are used? So one is a spinal cord injury, as in this patient, where we place the lead in the midline of the thoracic spine. This is the thoracic 9 and 10. This is lying over the spinal cord, and a lead leads to a battery which is placed under the skin in the buttock area in this case. So the use of spinal cord stimulator, apart from spinal injury, can be in phantom limb pain. So if you had somebody with an amputation of the arm or the leg, they may still feel pain in the missing arm or leg. And in that case, this has been very useful. Similarly, with neuralgia coming from diabetic neuropathy, you can have people with severe foot pain, which is not responsive to regular medication. Spinal cord stimulator can work. And similarly, with herpes neuralgia, common treatment, most people do not require long-term treatment, but those who have persistent pain, persistent neuralgia over the chest, over the arm, over the leg, it can be treated with spinal cord stimulator. So this is just to make patients aware, to make the family aware and the doctors aware that there is no need for patients to suffer with pain with any of those conditions. There is a solution with spinal cord stimulator. Thank you.